This PICO question aims to find whether or not a novel occupational therapy program is more effective than standard medical treatment for clients who have been diagnosed with mild to moderate dementia. There was very limited research on this topic, as most of the studies focused on severe dementia and the intervention aimed at minimizing fall risks and more so palliative care. There were few studies that actually used a quality of life outcome measure in the research, and there was no research that investigated a multidimensional approach, and many of the studies actually isolated a variable. And due to the progressive nature of the dementia, some studies focused on relationships in a social context with the caregiver. So the first study by Kumar and colleagues used 77 participants in a multidimensional approach intervention that consisted of relaxation, personal activities, cognitive exercise, recreational activity, and physical exercise. And the comparison intervention received standard medical treatment, however, it was not specified what that was. And the article showed that the intervention group actually had statistically significant improvements in the physical domain and psychological well-being domain of the World Health Organization quality of life outcome measure used in this study. The second study by Kolanowski and colleagues addressed 3 intervention groups, and this was for 128 participants who were diagnosed with dementia. And the functional level was the first group, in which the activities provided in the intervention matched the functional skill level of the client, but not their personality. The second group, the personality style of interest group, the activities matched the personality of the participant, but not their functional level. And the third group, the FL and PSI group, had activities given to them for their intervention that matched both their functional skill level and their personality. And the comparison intervention was the active control group, who had an intervention that did not match their personality nor their functional skill level. And there were several outcome measures used in this study, as you can see, and those outcome measures showed that the PSI and the PSI plus FL groups had statistically significant improvements in the categories of engagement, alertness, and attention. The third study by Voigt-Radloff and colleagues used 141 participants who had been diagnosed with Alzheimer's or mixed-type dementia, and they were replicating a protocol that was used in a previous study, and this was the Community Occupational Therapy and Dementia Program. So the diagnostic phase really focused on actually identifying the problems the client was having. This was followed by a goal setting session in which the caregiver, participant, and therapist all set goals for the participant, and then the treatment phase is when those goals were actually implemented and the therapy happened. The comparison intervention, the community occupational therapy consultation, was just a 1-hour consultation that addressed dementia care and the availability of the community resources. The 2 outcomes measures used are listed, and those showed no statistically significant differences between the 2 groups. So these studies provide a basic foundation for further research to be conducted that does address a multidimensional approach. Though they didn't all have statistically significant results, we can still extrapolate valuable information from each of them. So the first study can be replicated and focus only on the parts of the intervention that did work with a larger sample size to provide evidence-based research that can be generalized. And the second study really highlights the importance of client-centered therapy by demonstrating the importance of providing meaningful activities for that specific client and meeting their needs at a functional skill level to allow for those small successes in the therapy session to keep them intrinsically motivated. The third study demonstrates the difficulty of using interventions cross-culturally. You may have statistically significant improvements in one country, but that doesn't mean it'll translate across cultural contexts. And this study emphasizes the need to obtain the full occupational profile from your client to create an intervention plan that really parallels their belief and value system. So through more evidence-based research, we'll be able to widen the array of interventions that we can use and really choose the best one to meet the needs of our client with that goal of maximizing their quality of life.